Good morning, I'm Dr. Jeffrey Watson. You know, health is a state of spiritual, socioeconomic, psychological, and physical state of well-being, not simply the absence of disease or being in the hospital. I am a board-certified internal medicine physician. I've been practicing in Oakland for over 30 years. I practice in the hospital and I practice in the office, and often I come to you at your church or your community event with health fairs. Watch the Healthbeat show. We'll be talking to you about how to live healthier. We'll be talking to you about disease prevention. We'll be talking to you about how to think correctly, everything from your nose to your toes. The 8 healthy guidelines of living. Watch us on the Healthbeat show. You will learn truly that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. Watch the Healthbeat show.
You're watching the Healthbeat show. This is our Mentor in Medicine segment. Our special guest, Dr. Esteban Burchard. Dr. Burchard is a physician scientist, a professor of pharmacy and medicine, University of California, San Francisco. Dr. Burchard, welcome to our program.
Thank you very much.
How did you get from, tell us where you started and how you got to where you are as a professor of medicine, University of California, San Francisco.
Well, thanks. I grew up in the Mission District of San Francisco, which is primarily a Latino and African American neighborhood. I had a single mom, and I was raised by a network of minority women. And in fact, I was raised in part by a Chinese family. And I went to Chinese school in Chinatown. And when I needed mentorship, I needed strong male model mentors. And I found that through wrestling.
So you were raised in San Francisco, single mom, Chinese family. Tell us about that. What was that all about?
So my mom was Mexican, spoke Spanish and English, and I spoke Spanish. And when we needed help, and many women came to help me, but one family in particular, a Chinese family, took me in. And I actually went to Chinese school in Chinatown up until about 13. And when I needed positive male role models, I found that through wrestling.
Now, you didn't just go from middle school to successful wrestling. There must have been some turmoil in between. There must have been something that led you to know that you needed positive role models.
Yes. So I was kicked out of my first high school because I was a teenage boy without a father, and my best friend was shot and killed at the age of 14 in the Mission District. And I realized then that I needed a change, an intervention. And so I was fortunate to find that through sports, wrestling in particular. I wrestled through high school and college. My coaches were African American. My main coach was on the 84 and 88 Olympic team. And in college, my study partner, African American, was an NCAA finalist. So I received a lot of positive mentorship, role models, and discipline through that. And I applied that in college to my academics.
So when you were wrestling, you think that kind of formed you, and you still use many of those same disciplinary skills today, and
of course, absolutely. I think about wrestling every day. I apply the discipline, the self-confidence, the mental toughness to my academics. And even that's what got me into medical school. It helped me become who I am. I became a 2-time NCAA academic All-American, and that propelled me into medical school. I got to medical school at Stanford, and that discipline got me through medical school and got me to Harvard.
So you went from the streets of the Mission, thrown out of high school, into a wrestling program, on to Stanford and on to Harvard.
Yes.
Now, tell us a little bit about what those experiences were like for you as a student from the Mission.
Well, I went from poverty, if you can imagine the tarmac being poverty, all the way up to 40,000 feet. And it was a tough climb. And people let me know that I didn't belong, that I didn't earn it. But because of the mental toughness that I've developed through wrestling and mentorship and positive male role models, it allowed me to persevere and actually excel at Stanford and become one of the top students in my class, and that's what got me into Harvard.
Now, along the way, you did have mentors, and most people can sometimes find mentors, but a lot of people face the same barriers that you face as ethnic minority physicians or trying to be a physician. You don't belong, you shouldn't be here, you don't deserve it. That must have been tough at times, as you said.
It was very tough. It was very tough. But the discipline that I got through wrestling and the mentorship, my best friend today, I'm 50, continues to be my study partner, who's African American, NCAA finalist. And I think that this is an issue that a lot of young men, boys in minority communities or low-income communities face in particular. And this is where having mentorship, whether through the Boys Youth Club or other forms of sports, can be a guiding strength that you could apply to other aspects of your life.
And so your journey is a journey that many people feel at some point is impossible. But your success, I think, can be a model for others. Now tell us exactly what you do now. Where are you, and what is your position now, and what are those responsibilities? And in the next part of our interview, we'll talk about some of your research, but go ahead.
Well, I'm a pulmonary physician, so I specialize in lung disease for adults. I'm a professor of medicine at UCSF, University of California, San Francisco, and a professor of pharmacy. I lead one of the largest research groups that study minority children with asthma in the United States. I teach students, I mentor students. I still take a lot of low-income students from low-income backgrounds in San Francisco, whether they're high school students, whether they're graduate students or medical students, or even young doctors. And I'm training an army of scientists and physicians to do exactly what I've been blessed by God to do.
It goes back to an old song. You come a long way, baby.
I sure have.
All right, our discussion with Dr. Esteban Burchard. We'll continue that discussion right after this break.
You're watching the Healthbeat Show. We'll be right back after these very important messages. Stay tuned.
Hi. You think you're probably sober?
Yeah.
But you're thinking about taking the back roads home, just in case. Why would you do that?
Probably okay isn't okay. Call a cab, a car, or a friend.
Good choice.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
All right, welcome back to the Healthbeat Show. Welcome back to the Mentoring in Medicine section. Our special guest, Dr. Esteban Burchard, a physician scientist, professor of medicine and pharmacy at the University of California. Dr. Burchard, continue our discussion. Tell us a little bit about your research, especially as it relates to minority children and asthma, and especially as it relates to pollution.
Well, as background, asthma is the most common pediatric disorder in the United States, but it has tremendous racial disparities.
What racial disparities means?
The rates of asthma are highest in African Americans and Puerto Ricans. The death rates are highest in African Americans and Puerto Ricans. Yet in the United States, 95% of all NIH-funded research focuses in on whites. So what I've made my life's mission was to better understand why is it that minority children suffer disproportionately from asthma. They have the highest rates, the death rates, highest or poorest drug response. They live in the poorest neighborhoods, which are adversely affected by air pollution.
So what have you found?
Well, we found that African American children living side by side to other children are more susceptible to a given amount of air pollution.
So that means that they suffer from air pollution that others consider normal?
Yes, exactly. The levels of air pollution that we showed that cause asthma in African Americans are far below current Environmental Protection Agency standards.
And so tell me what the research discovered and what's the implications? And what do we do about it?
Well, we took a very comprehensive approach. We're looking at genetic factors, we're looking at social factors, as well as environmental factors. And low-income minority children have a double jeopardy. What we call, they are more susceptible to air pollution. They suffer from discrimination that makes asthma worse, asthma attacks. They suffer from genetic differences that lead to poor response to commonly used medications like albuterol.
And so the drugs, the puffers that we use for as rescue medicines for asthma, don't have the same impact on Latinos and African Americans?
Absolutely not. These drugs were developed in white populations and generalized and applied to minority populations. We clearly demonstrated that African Americans and certain Latino groups that had the highest mortality from asthma, had
mortality
the
means dying more?
death rates, have the lowest drug response to commonly used medications. And in fact, if you read the package insert for some of the medications, it clearly demonstrates that if you're African American and take this medication, you have an 8-fold increased risk of dying.
So what do you do? I mean, what medicines are there? Medicines that are safer for African Americans are there? What can you do medicine-wise?
So we are on the pathway to identifying genetic factors that determine your response to medication. And we know that some populations, drugs work better in one group versus another group.
Well, we also know, though, that when we start to talk about asthma, we also have to talk about triggers. We have to talk about the social determinants of asthma. Medicine is just one piece, but it is important to know that the medicines that we depend upon are not reliable in minority populations. But what are some of the other social determinants of health? We know diet is one, violence. What are some of the others that are more important?
We just demonstrated clearly that amongst African American children and Latino children who experienced discrimination, they had more asthma attacks. It happened more frequently in African Americans than Latinos, but it was present in both groups. That's one factor that contributes to it as well. We demonstrated that neighborhood violence is also a contributor to asthma attacks, as well as air pollution.
And that air pollution piece is the piece that I think most of us are most concerned about. Because obviously, if in fact people are satisfied with air pollution levels that are dangerous to African Americans, what should we be doing? What should we be saying? Where should we be going to make that change?
Well, we need to enforce government standards, number one. We need to be politically active as a community, as physicians, as patients, to demand that the government standards reflect where the true risk is. We as an individual can help by walking more, using public transportation, using healthier alternatives with respect to transportation.
And what about the impact of climate change on asthma and on ethnic minority populations?
Well, the climate has actually improved, and there was work done in Southern California that clearly demonstrated that with the decline in the level of air pollution, children did better. So right. That's a positive intervention.
And as it relates to climate change, was a little bit different. Climate change is real.
It is real.
It does disproportionately affect African Americans, right?
It does.
And there's something we all can be doing to try to change it.
Yes.
All right, our conversation with Dr. Esther Burchard will continue right after this break.
I'm Dr. Jeffrey Watson. If you want to ask us some questions or you have a topic that you'd like us to explore, go to healthbeattv.info. I'll be glad to work with you in any way that we can, because I always believe that if you knew better, you could do better.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please
Don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Here's your health tip of the day. One of the main things that you want to do is try to get 8 hours of sleep. 8 hours of sleep will help you to think clearer. It will help you on your job. It'll help you with driving. It'll help you in school. Rapid eye movement sleep is the sleep that is deep sleep that helps your memory and helps you to feel refreshed. Go to bed, turn out the lights, get rest. Because if you knew better, you could do better. Get some sleep.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
Welcome back to the Healthbeat Show, the Mentoring in Medicine segment. Our special guest, Dr. Esteban Burchard, University of California professor in pharmacy and medicine, a physician scientist, one of the youngest in the university system, I might say. It may not look that way, but that's the way it turns out. Let's talk a little bit about research in African American communities. Very touchy subject among African Americans. Obviously, the background of the Tuskegee study, where they were given syphilis and no treatment, has African Americans much more concerned. The data collection that allows people to be stratified has African American and Latino communities concerned. Why should ethnic minorities get engaged in research?
Well, that's a very good question, and it's very important. There's a tremendous revolution in science and medicine occurring. And unless minorities participate in research, they're going to fall out and fall behind and be missed opportunities.
Now, when you say revolution, now that's a big word. What does that mean?
Well, the intersection of modern advances in computer technology, Google, and advances in genetics and medicine are combined together to revolutionize science and medicine, and it's important that we include minorities in all clinical and biomedical research, health-related research, so that they can benefit as well than their white counterparts.
What happens when they're not included?
They missed out. And then we develop drugs, we develop new therapies, new ways to diagnose disease that might be only applicable to whites and not applicable or generalizable to African Americans and Latino populations.
And when you say there's this intersection, how does that come out to the average individual? Does that mean that special drugs for special genetic populations, special drugs for people with red hair, green, what does that mean?
So this is what we call precision medicine, developing a drug specifically for you as an individual patient. We've made the tremendous advances in cancer therapy where they'll tailor a drug based upon your particular type of cancer. That is what we want, precision medicine. And yes, there are populations that respond better than others. A very good example is the #1 heart drug for heart attacks and strokes. Doesn't work in 50% of Asian populations. Yet, if you have a heart attack today and are Asian and go to any modern hospital in the Bay Area, you're going to get that drug whether you like it or not.
Because they don't know, because you don't know?
Well, the drugs were primarily developed in whites and generalized to other populations. And Asians don't have a genetic variant that metabolizes that drug.
What do you say to African Americans and Latino populations who say, I'm afraid, I don't want to go into these studies. They may know too much about me. They may come pick me up. They may give me no treatment. What do you say to them?
These are valid concerns, but I think that it's important for the African American and Latino community to be actively engaged in participating in clinical and biomedical research. And that'll improve the health of themselves as well as their entire community.
Is research such that you can allay the fears of populations that they won't be not treated, that they won't be given the disease and not the treatment? What assurances can you give to that population, to our population?
I think it's important to have more minority scientists, physicians, and scientists at the table in the design of the research phase, in the active recruitment of minority patients, explaining to the community. I think we need community engagement. I think that having more minority physicians and scientists will help allay a lot of that stigma, the fear, which are very real.
When you talk about the need to have engage more minorities in unique research, I recall some statistics that say that when the NIH gives out grants, it's not looking for ethnic minorities. At least it doesn't have a very good record of that.
The NIH, which is funded by all of us taxpayers.
That's the National Institutes of Health,
which is the primary funder of clinical and biomedical research in the United States, funded by taxpayers, has largely left minorities out of clinical and biomedical research. For lung disease, which I study, we demonstrated in the last 20 years, 95% of the NIH budget has focused exclusively on whites.
And so we need that. How do we change that? What do we do?
Well, my group and I are actively involved with the help of Congresswoman Barbara Lee to alert Congress and the National Institutes of Health of this problem. The NIH, the National Institutes of Health, is responding by now including more minorities, and I've been blessed to be able to move the moral compass of science towards social justice through my activism.
Well, Dr. Burchard, the apple doesn't fall too far from the tree. I still sense a lot of mission in you. Even though you've gone to Stanford, you've gone to Harvard, you have certainly achieved far above what expectations would be for any person, regardless of where they started. And the barriers that you've had to overcome should be a role model for so many students out there who want to be clinicians, scientists, and the like. So we thank you for taking the time to join us. And thank you for taking the time to join us on this segment, Mentoring in Medicine, the Healthbeat Show. I'm Dr. Mike Lenore. We'll talk again.
You're watching the Healthbeat Show. We'll be right back after these important messages.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed our own.
Today, women can do anything men can do. And there's one thing we're even better at.
Stay tuned to the Healthbeat News right after these messages.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just please, don't leave. Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
I'm Dr. Watson, and many of you will ask your doctor, "Doctor, I need some more pain pills." Well, prescription pain medications are naturally becoming the #1 abused drugs on the streets. We're talking about promethazine with codeine. We're talking about Vicodin. We're talking about OxyContin. We're talking about morphines. These are the things that people are using in excess, and they're accidentally killing ourselves with them. You may not know it, so you really need to talk with your doctor when you're taking pain medication and develop, first thing, a pain contract. When you develop a pain contract with your doctor, the doctor will usually tell you, you can only get one prescription every month. Because if you are refilling things and you're treating things without talking to your doctor, sometimes you can overdo it on yourself. And we know many popular people in the media recently who have overdone it on themselves because they thought that they knew what they were doing. So get a pain contract with your doctor. That means you get your pain medicines once a month. If you lose them, you can't get another prescription because you got them once a month. Get them from one pharmacy only. Get them from one clinic or one provider only. In this fashion, you'll make sure that you don't mix up the medications, because if you're getting something from one doctor and another doctor, they don't know. You might mix them up, and the next thing you know, you're sick, and we have people having accidental overdosages and death as a result of it. Pain medicine are the #1 medications that are being abused on the street right now and by our young people. Keep your stuff locked away. Don't let it get out. As a result of this, people are hurting themselves. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth, and when you have your health, you have everything. And I've always said to you that if you knew better, you could do better. I'll see you next time. I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.